Imagine your heart racing 250 beats per minute, sudden, unpredictable, and life-threatening. This is Paroxysmal Supraventricular Tachycardia, or PSVT. A condition affects millions of patients worldwide. What if innovation could change everything? Breakthrough in wearable monitoring, AI-driven diagnostic, next-generation ablation technique, or revolutionize how we detect and treat PSVT. Biotech companies are at the forefront of this innovation, and Evergrowth is on the lookout for this company to capitalize on the future of cardiovascular innovation. Hi, I'm Dr. Harvey Tran, CEO and co-founder of Evergrowth Biohealthcare Capital. Join us as we discuss PSVT and the latest development and diagnostic for this condition. If you're looking for an investment that combines cutting-edge science with market potential, Evergrowth could be a perfect fit for you. Click the Calendly link below or scan the QR code to schedule a free consultation call with me.
Topic today sounds very interesting, which sound more complicated than what it is. We call it paroxysmal supraventricular tachycardia. And today we're going to present the current data and also the advancement in this field of medical topic that we cover every week. You know, a lot of us experience some fast heart rate, but also can have fast heart rate and regular rhythm, but also can be irregular rhythm. And we have covered in the past atrial fibrillation, which is fast heart rate and irregular rhythm, whereas SVT, supraventricular tachycardia, is fast heart rate, but with regular rhythm. And it occurs mainly from the chambers above the ventricles called atrium. And those chambers have electrical signal that can cause our heart to go in cycle and result in very fast rate. And we define that as supraventricular tachycardia. The term paroxysmal referring to the abrupt onset and termination of this rhythm. And it can be as fast as 150 to 250 beats per minute. As we see here, the supraventricular tachycardia tend to occur from the upper chambers and rotate in cycle, result in the heart beating very quickly. The prevalence, approximately 2.3 per 1,000 people expect to have this condition. A lot of it, as you see here in etiology, have to do with congenital condition, meaning something we were born with, and we start to experience this sensation as a child. And then as we get older, doing more activities, our heart found this pathway and start going there more and more. So a lot of the congenital condition being diagnosed when the patient reached the teenage years. And that's where we found that they have accessory pathways that they were born with result in this fast heart rate and sensation of fast rhythm, but it's really just a rate. The rhythm remain regular. Some of us can also acquire this condition by using some substance. As we mentioned earlier, many of us have their favorite drinks being caffeine or caffeinated products, which can also cause the SVT to be illicit. Alcohol is also another stressor for this arrhythmia. And then, of course, every time patient come into the ER with this condition, we also obtain labs because they may have electrolyte abnormalities. And then we review the medication to make sure they're not on other medications that can cause the condition beside being on medication for this particular condition itself. Types of paroxysmal supraventricular tachycardia, including what we call atrial ventricular nodal reentrant tachycardia, which most commonly occur because of dual pathway in the atrial ventricular node in the heart. But we can also have pathway outside of the atrial ventricular node. We call them accessory pathway, and we label this condition as AV reentrant tachycardia. We also can have atrial tachycardia that originate from ectopic focus outside of the sinus node. I should say sinus node, not outside of the atria, but is still in the atria, which is outside sinus node. At the same time, we also have inappropriate sinus tachycardia that occur within the sinus node. The sinus node is the God-given pacemaker site that we have to initiate our cardiac rhythm. The important facts about SVT a lot of us don't know or not be aware of is that SVTs is a risk factor for sudden cardiac death in patients who are considered congenital heart condition. And in these patients, the SVT also predispose the patient to have a coagulation risk resulting in stroke, thromboembolic events. So this patient should be on systemic anticoagulation for SVT, in addition to if they have other arrhythmias such as atrial flutter or atrial fibrillation. The effects on the body: the fast heart rate can lead to reduced cardiac output, result in symptoms of reduced cardiac output such as tired, fatigue, but also can cause patient to pass out, cause syncope, also can result in congestive heart failure symptoms. The main symptoms a lot of these people have would be palpitations, chest discomfort, pain, lightheadedness, dizziness, shortness of breath, sweating, or we call diaphoresis. Also, nausea can occur as well. The signs: patient would have tachycardia on vital signs. They may also have low blood pressure. If that occurs, it becomes what we call unstable SVT, that hemodynamically significant. Then the treatment would be urgent, such as using electrical shock to shock their heart back to normal rhythm. But patient can also have signs of heart failure, such as weight gain with leg swelling, abdominal swelling, and also crackles sound in their lungs. How do we diagnose this condition? We obtain ECG that show a narrow QRS complex, meaning that the ventricle is contracting normally and conducting normally, but the fast rhythm is actually occur from above the ventricle. Of course, we monitor with telemetry monitor. In the old days, we used to call a Holter monitor, but now we call either 3 days, 7 days, 28 days telemetry monitor to capture the moments of these type of arrhythmia. And then the ultimate diagnosis will be electrophysiology study, where we map the conduction system of the heart to try to find out where the arrhythmia coming from. Is it coming from the atrioventricular node, or is it come from accessory pathway, or is it come from the sinus node, or other ectopic focus in the atrium? Treatments: the first way we treat this patient in the office or in the emergency room would be asking them to do Valsalva maneuver, or we can do carotid sinus massage at bedside. And then if it's not effective, we can give the patient IV adenosine for acute termination. And then we can also give beta blocker or calcium channel blockers or other antiarrhythmic medication to treat the condition and also prevent their recurrence. But the ultimate treatment for cure would be catheter ablation if they wish to proceed that route. A lot of time I mention to my patient, I would recommend catheter ablation if they, number one, they cannot tolerate the arrhythmia or they cannot tolerate the medication. The ablation is fairly effective for immediate treatment. The success rate is over 95%. However, the prognosis for the ablation, as you see here, the recurrence after ablations in several studies have shown anywhere from 7 to 10% per year, and 20 to 40% of the patient may require repeat ablation. And half of these recurrence usually occur within the first 14 days to 3 months. New medical trends. Our trend nowadays for our patients would be recommend for them to have wearable device, either short-term or long-term telemetry monitor. As I mentioned earlier, 24 hours, 3 days, 5 days, 7 days, 28 days telemetry monitor. But we also have implantable long-term monitor called internal loop recorder that can be in your body for 3 years. And then the battery would run out, then remove the internal loop recording. We also have new technology, as you know, with our smartwatch, which can be used now for monitor the heart rhythm and heart rate. So I recommend all my patients who have SVT to consider investing in a smartwatch that can monitor their heart rate and rhythm, whether it's Apple or Samsung or some other brand. But I think the most reliable, what I've seen, would be Apple and Samsung rather than some off-brand watches. And then, of course, we have improved ablation techniques. Previously, we have radio frequency ablation, but now we also have cryoablation. Now we have laser ablation. So various ablations now available. New facts we have on this is big research into genetic to predict the predisposition for patient who has SVT. Hopefully in the womb, and then as baby or infant can also be performed if we do genetic evaluation of the person. Of course, we have other non-invasive evaluation using different device. We have different new technique to provide implantable device in the body for early detection as well. Ways to improve. Hopefully, we can develop a marker to detect early sign of tachycardia, because when the heart cells working hard, it can emit out certain biomarkers, allow us to detect this type of arrhythmia even before the patient would have symptoms. And of course, we mentioned in the past about gene therapy for a patient who has genetic predisposition or genetic condition, such as the congenital arrhythmia, as I mentioned earlier. The AI and machine learning also allow us to have better prediction on when these PSVT episodes may occur. If you drink this type of drink, most likely would it occur? What percentage would occur? Is that something you want to consider before you take a drink? As you will see in the future, we probably can have a futuristic approach, looking at a drink and scan it and say, okay, if I drink this, what's the chance for me to have an arrhythmic event? The question you may be curious to ask, and every one of my patients usually ask us, is anxiety or stress caused my PSVT or my SVT? And the answer is not really, but SVT has been associated with anxiety and panic disorder. So patient may feel like their anxiety disorder or anxiety syndrome causing the SVT, but in reality, it may be associated with it rather than the cause of it.
If you want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us, we'll schedule a call to see if we are the right fit for each other.